Oh, see, fine lady. Okay, someone said, fine lady, fine like an apple. Well, of course, apple is quite comely. So, today it's quite an interesting but sensitive topic. Many people find reasons to justify their actions in many things. So, but right now, I just want us to have a proper gist about abortion. What do you think about abortion? Many people want to know what health practitioners think about abortion. Right. So I'm coming to light and I'm here to give you what I, Nurse Kamsi and Mama, thinks about abortion. Follow me. So when the time I was posted to the theater, I was seated there. It was almost time for dismissal. I mean, I was still a student nurse back then, yeah. So I was waiting patiently for the time so that I could carry my bag and zoom off. So immediately we got a call that we have this patient in the emergency unit and this patient is coming to the theater for manual evacuation. I was like, what's that? That was my first time witnessing that particular procedure. So I was like, what's that? So they brought this lady, she was on the trolley. She was on a stretcher. They brought her with a stretcher. So funny enough, this lady already have soaked diapers. I mean, she used the diapers and the diapers were, so soaked with blood. Soaked with blood. So she was crying out and was like, please help me, call the doctor, because currently the doctor was not really around. The doctor went for one round. So she was like, please call the doctor. I need the doctor to see me, I need the doctor to handle me, I need the doctor to take care of me. So I was just looking at her and she was obviously pale. I mean, someone my color to lose so much blood that it is so obvious that she is white. That was what was happening there. I took a look at her fingernails and everywhere was so whitish. I was shocked. So I looked at her, she was wearing diaper still and the diaper was obviously filled up with blood. The wrappers and everything. So we just had to help her to, lay on the operation table and she got herself comfortable there. She kept crying, she was like, this is what I did to myself. I brought this upon myself. I deserve to die. She kept saying things and I was like, man, chill, calm down, alright? So the doctor came in eventually, we called the doctor already and the doctor came in. The doctor was like, what's happening? So took a look at her folder and looked at her and was like, oh, okay. So we started the procedure. Now when we started the procedure, we made use of the vaginal speculum, the puscular vaginal speculum, and then the doctor had to use it to view or to have a wider view of the vagina, and then had to use something to open the cervix, probe the cervix and open it to a very nice then he used suction tube. He used suction tube to remove some, not all. The suction tube can only remove just things that come in smaller particles. But because this lady in question carried out abortion and the remains of the baby was still in the uterus. Now what happens is this. Many of you are like, yes, why exactly do people bleed? Most people bleed like so much after abortion. Why? What is the cause? What is the cause? Is it that they use knife to remove the baby or they used rod, a sharp rod? No. Now the whole procedure or the whole process at which this bleeding happens is the uterus is a very jealous organ. The uterus loves its own space. The fact that you are even pregnant is enough discomfort for the uterus. And once it is 9 months, what the uterus wants is, can this baby and the placenta just get out already? Can they just get out already? So in a situation where the baby is out and the placenta is not out, the woman is going to bleed to death because the uterus is just going to keep rejecting the whole foreign body in it. And in a situation where abortion is carried out, and even if there are little matter of this baby flesh, little matter of the baby's remain in the uterus is going to keep contracting, and that contraction is what brings about that bleeding, and that contraction comes also with pains and severe cramping. So that is the reason why many people that carry out abortion you everly experience this. And now, because abortion is not legal in Nigeria, any doctor that is caught aiding or abating abortion, his or her license is going to be seized, and of course, along with the health practitioners that carried out the whole process with him or her. So that is the reason why you see some nurses will be like, you want to do what? Abortion? I'm not doing anything. And then they just resign, or they just get out of the place and they're like, I'm not doing, my hands are up, my hands are washed, like the Pontius Pilate, I wash my hands. So now, this person in question walked to some supposed hospital, because evidently the only person that will aid you in abortion is someone who does not know the medical principle or medical ethics. So people that are quack and quackeries, of course, quack and quackery. So these people are the only people that can ever help you in abortion or carrying out the procedure called abortion. Or we see those chemists, your lovely chemists, that can always help you in that regard. And now those people don't also have that equipment. And of course, those people, if there is a doctor amongst them that carries out abortion, they will not want to admit you after the abortion procedure, because they don't want a situation whereby something happens and then some people get to find out that abortion was carried out through your folder, through your files, because it's a shady something. They cannot keep you really in their hospital. They cannot admit you, although there are medical abortion. Now, medical abortion, we find it mostly in women, pregnant women that took in, and all of a sudden they went down with German measles. And honestly, a child that her mother, a fetus that her mother or his mother went down with German measles, such baby cannot come out and be normal or act normal. So his mental health is going to be affected, his physical health is going to be affected, his health overall is going to be affected. And that is the reason why doctors that find out, this is German measles, will just advise the mother, bring it as far, but this is the suggestion, this is what's going to happen. Do you want to cope with this? This baby is going to be more like impotent all his life, all her life. Are you going to keep up with this? No. So if the mother says yes, then of course it's very dangerous. So, but we're talking about criminal abortion right now. People that voluntarily opened up to receive penises or penis, and now they've got the reward of receiving penises or penis, and then they still like, no, we don't want to keep it. You gotta keep it. So now, in a situation where you go to meet your chemist doctor, your doctor that does not have authorization from the right body, of course, they're gonna end up using D&C method to do their abortion always, because no doctor, no chemist has the instrument to view your uterus while carrying out the abortion to see if it's actually removing the right thing or not. So now you see this video here, because the baby is a bit older, this person has to make use of first step to dismember the baby, the leg, the hands, and then when it gets to the head, have to crush the head, because the bone of the head is a bit mature, not really mature, but a bit mature. Crush the bones to ensure that we can remove it properly. So crushing that bone is what brings about scattered pieces of the baby's body in the uterus. So that is where the current comes in. The current will ensure that you scrape off all remains of the baby's body. Now, in a situation where you are using the current, of course you are not really seeing everything, because this person is a chemist doctor, this person is not a professional doctor, this person does not have those ethics, and of course this person does not want to be caught in the act. So he's gonna have to rush it up. He has to rush it up. So he may sedate you and then use the carrot and scrape off, and eventually the whole baby part is totally scraped off. But here is the problem: as he was scraping off the baby part, trying to scrape off the baby part that have been crushed and scattered in your uterus, what happens is that it can lead to perforation, since the layers of the uterus is also a soft one. It's not made of bone, right? Yeah. So it can lead to perforation of different part of the uterus. So that perforation can actually lead to bleeding, or can lead to infertility, because the uterus is where egg is implanted and starts growing and starts developing. So in a situation where there are different kind of perforations here and there, and only God knows how many times you have gone for this abortion, it means that the chances of you giving birth reduces drastically. Drastically, it reduces. Even people that makes use of this current for taking samples, biopsy, they make use of hysteroscopy to view the uterus. So they pay much attention. So what I'm trying to say in essence is that be careful, because most of these drugs, most of the abortion procedures, they are not done with so much carefulness, because the person in question knows that abortion in Nigeria is very illegal. So he has to try as much as possible to hurry it up and then tell you have to go home immediately. If you have done abortion everly and you're watching this video, please ask yourself this question: have you ever carried out abortion and they ask you to sleep over till the next day so that we can watch after you, we can look after you, we can take care of you? No. Once they do it, they tell you start going home and they'll give you some drugs for pains, and that is it. If complication arises, you will not even find it so easy to open up, because you know that it's a shady business from onset, right? That is it. And in other cases, we see people that went down with infection, septicemia, blood infection, and I tell you, this is a very bad one and can lead to death. Septicemia alone can lead to death. So I want to urge us all, if you know that you cannot carry a baby, I don't know why you have to go about sleeping around. I love you and I want you to take care of yourself. So many people are like, I want to say this, many people are like, Postinor 2 is gonna do the needful. Now Postinor 2 is an emergency contraceptive. ECOP. Alright, so now emergency contraceptive can only help you from the range of day 1 that you had sex without protection to about day 5, and that day 5 is other probability. So if your hopes are hung on taking Postinor for life, it also comes with large complications that you don't even want to take part in it. So I just want to urge us all to take care of ourselves and of course maintain safe sex. If you are not ready to raise a child, please try as much as possible to not even go for it. I love you still. Your Sam's here.